there's a lot of COVID fatigue, which means that people understandably are tired of hearing about COVID, and they wish it were over.
COVID hit underserved populations naturally, just much harder because they had higher rates of all of these diseases. They had higher rates of obesity, they had higher rates of other medical conditions. And so we saw underserved populations end up in our hospital at a much higher rate.
There was a lot of things that was happening because of COVID. So this just opened our eyes to what was really going on, but it also enhanced what was happening.
Personally, it was very scary. It was overwhelming, fear of the unknown, away from my family because I was a nurse, or I am a nurse. And, my family wanting me to, stop nursing, just because, of course, everything that was put out was just all negative. I think I've always seen the cracks, just because a lot of times you go into areas, primarily rural settings, where your healthcare team doesn't look like you. And for the most part, what I've observed and being in one of those, patients as well, is that, we're often not heard. You know what I mean? We're speaking, but they're not listening. And so I think when COVID happened, because so many people were dying, a lot of us were even scared to go to the hospital, and it was even put out there to, not come to the hospital because you may die if you're in the hospital, because the cases were just so much, there were so many cases. But even before that, I think one of the problems that we go through as being African Americans is that there is unfortunately, still racism in the healthcare system.
If you look at any uptake of vaccination, underserved communities frequently get fewer flu shots. If you get fewer of the non-mandated vaccines, the ones you don't have to get for school. And I think there are a couple of reasons for that. First is often just access to care. They don't always have a primary care doctor they can walk into their office and easily give a flu shot. They don't have insurance, so they can't afford to go to a drugstore and get a flu shot. But if you look at, there's also a suspicion of the medical system. If you look at the history of medicine in this country, there are things like the Tuskegee experiment, which often give underserved communities good reason to distrust the system.
Well, in this country, unfortunately, where we don't have universal health care at no cost to the patient, we have people who haven't had insurance and therefore don't get a whole lot of preventive care. So they come for medical care, often to an emergency room with later stages of a problem that can be more difficult to remedy. Other aspects, if people are food insecure or don't have a stable living situation, their ability to follow through with recommendations for healthy lifestyle is limited. And when it comes to looking at marginalized populations, particularly people who have been victims of racial discrimination, there's a whole lot of distrust.
And so you're taking an underserved population who has a natural inclination and good reason to not quite trust the system, and you're telling them not to trust the vaccination. And as a result, we saw more hospitalizations, more severe illness, and more deaths in underserved communities.
I would love to go to someone that looks like me, that can relate to me, that knows the things that go on with my body as an African American woman, and not just treat me and you as we are the same, because we're not. And I think that has a a big factor in it, especially when it comes to the mental health aspect and the African American community.
When you look at population compared to the percentage of individuals within that population, you identify that minorities, Black and brown individuals has a lower percentage of people, but they had higher death rates and lower vaccination rates, if you will, because of the barriers and disparities that was already taking place in there. Now, when you add a pandemic or any type of issue or virus on top of that, well, again, so let's just take the rolling out of the vaccine. In and of itself, the goal was to get people back to work and society back up and running. However, the first rollout was healthcare workers. There's not a whole lot of Black and brown individuals per capita in the healthcare field. Then you had the rollout of 65 and older, but because of underlying diseases already, 65 is probably the modality age of an individual that is a minority. And then you're looking at computers just so that you can get individuals, a lot of people in one place to get vaccinated at one time. Well, a lot of elderly minority people were not able to use electronics, and if they were, they couldn't stand in long lines for those things. So there was natural disparities that took place just because of the nature of where we were.
Yeah, so central Pennsylvania, as you might imagine, is heavily white. And in a population that's aging relative to most other states. So a large majority of the people that rely on our services fit that description. And what we found pre-pandemic, our neighbors that are either Black or non-white Hispanic were 3 times more likely than white people to be hungry, to be facing hunger. That actually was exacerbated during the pandemic, so it got worse. And we're still in a similar situation where the disparities have increased. We started working more during the pandemic with what for us was new partners, so think healthcare organizations, think housing organizations, other social determinants. So in that process, in working with those folks, we had a better view on just what was causing some people to need help, to face hunger. So evictions and just a high cost of really rapid increases in housing costs. We saw that was actually bringing people into pantries that we hadn't seen before. The level of evictions really mattered. In healthcare, just the ability to get good healthcare services. So if your insurance is very good, you're probably not going to be left with as much in the way of medical bills. But if it's not very good, or if you have gaps, which a lot of people have gaps in their insurance, or very high deductibles, that's really meaningful each month. And that could really put you in a position where you can't afford to buy enough food. So pretty much all the major social determinants, the pandemic brought some kind of disruption to them.
Going forward, we have to figure out ways to pay more attention to the non-medical parts of healthcare, the social determinants of health. And I think the COVID pandemic highlighted that.
So there are more things that we need to do, and as a society, beyond the individual level in being able to get your vaccine and take antiviral medication when you get infected, we need to fund public health so that we're not caught off guard with too few ventilators, too little personal protective equipment, et cetera, et cetera. We need, in rural communities like ours, we need a local health department that can keep track of the numbers that are so hard for us to come by and put out clear, consistent messaging, coordinating the messaging from the 2 competing healthcare systems and other healthcare systems.
So what we're seeing is that right now, we have as high a level of demand for our services as we had in 2021, the very height of the pandemic. So the challenge for us in our work is we don't have as much of the government supplied food resources. They were very helpful during the pandemic, steering food supplies to food banks in abundance. And now we're dealing with the same high level of demand, actually a little bit higher, but we don't have those food sources that were available then. So we're working hard with all of our donor companies and other farms, everything. But it is a challenge putting together the food supply week to week in our work. And that's not just Central Pennsylvania Food Bank, that's a national story. So we're in this kind of challenging time where it seems like things are better, but we have more families coming for help than we've ever seen before, including during the pandemic.
I wouldn't say much have changed. I don't think we've truly gotten down to the root. I definitely think as healthcare providers, we can definitely push it a little bit further to provide more services. They target like a lot of low community areas, of poverty. But there's also middle class that are, trying to survive and living paycheck to paycheck. So while they're focusing so much on the poverty levels, we're forgetting about the middle class, people who are living paycheck to paycheck that can't afford that $500 a month health insurance, that make too much to get assistance from, the government. But then again, you can't afford to pay for that insurance on your own. So it's another demographic that I think we need to start looking at.
Now that these disparities that Black and brown individuals have already been living under is now exposed, hopefully that this pandemic has given the government an overview of what needs to take place in healthcare, what needs to take place in the communities. Closing supermarkets may not be the next best thing, or providing a suitable alternative to those areas. So I think it is still the same. We just have more of an awareness. And now part of the Black Equity Coalition is to enhance the work that community service workers are doing. Those people in the community, working in the community, enhance what they're doing so that they can have more of an impact. And then teaching them how to engage in getting more grant dollars to do more work in the community and so on. There is a path for it.